Hi everybody, I am Thatnursingprof and welcome to my channel. In today's video, we're going to be talking about how to conduct the Mini Cog Assessment on your elderly patient. So let's get into it. So what is it? What's the Mini Cog? It's a test that we do. It takes about 3 minutes, so it's really short, super easy and convenient to do. And it helps us to increase detection of cognitive impairment in the elderly, in the older adult. There are a couple of steps. The first step is you want to make sure you have their attention, because if they're distracted, they're not paying attention to you, this isn't going to be accurate. So ask them, okay, Mr. Johnson, okay, Mrs. Johnson, are you ready to begin the test? Right? Making sure you have their attention. The second part is you're going to tell them 3 completely unrelated words. And it is recommended that you use the words provided by the official standardized Mini Cog. Don't make up your own words. So for example, we're going to use the words banana, sunrise, and chair. Completely unrelated to each other. So you're going to say, okay, Mr. Johnson, I'm going to tell you a few words, and I want you to repeat them back to me. Banana, sunrise, chair. So ask them if they can repeat it back to you right away. If they can't, give them 3 chances to try. So if they can't remember right away, you can repeat them again. You can say banana, sunrise, and chair again, and then ask them to repeat it back to you, and they have 3 chances to get it right. And if they don't, that's okay. If they do, that's okay. We move on to the next step either way. So they've done this, they've had their 3 chances, they were either successful or not. Then we move on to step 3. We're going to ask them to draw a clock. And usually we will provide them with a paper that already has the circle part. So we're not going to make them draw the circle. So we'll give them the paper with the circle on it, and we're going to have them do a couple of things. First, they have to put all the numbers in the circle. So drawing a regular clock. Like the 12 will be here, the 6 will be here, that kind of thing. So can they get all the numbers, and can they get them in the right spaces? That's the first part. The second part, after they've drawn the numbers, we're going to tell them a time. So a common time we can tell them, 10 past 11. So they need to draw the hands on the clock to draw 10 past 11, okay? And they have 3 total minutes to complete this task. And after 3 minutes, if they haven't been able to finish it, that's okay, we move on. And then the final step is step 4, and we're going to ask them again, remember those 3 words we talked about earlier? Can you please repeat those words to me? And they will be able to, or they won't be able to. That's the 4th step. Now let's talk about how we grade this. Grading the Mini Cog is just as simple for the nurse as administering it. So the patient will get 1 point for each word that they remember in the word recall, and they will get 2 points for a normal clock. So how do we define normal clock? A normal clock has all of the right numbers, so 1 through 12, and you don't repeat them, they're only on there once. They're in the right order and go in the right direction. So instead of being, 12 here, 1, 2, 3, it'll be 12, 11, 10. So it'll be backwards. So that would be abnormal. And then they have to have the 2 hands, and the 1 hand needs to be at the 11, because we said 10 past 11 as our practice time, right? So 1 hand needs to be at 11, and the other one has to be at the 2. And it doesn't matter how long or short the hands are. I know on a real clock, right, the hours is shorter, the hour hand is shorter, and the minute hand is longer. That's not relevant for this test. They just have to have the 2 hands. The length does not matter. So if they have all these things, they get the 2 points. If they have any abnormalities or they're not meeting these criteria, they get 0 points, and it's considered an abnormal clock. So you'll add these together, and a score of greater than 3 is good. The higher the number, the better. So greater than 3 indicates a decreased likelihood of dementia. Now, it doesn't mean that there isn't any other cognitive impairment going on, because there could be. It could be mild, but greater than 3, that's what you want. That's a good score. And one thing I do want to point out about this test, it is not diagnostic. So let's say, for example, they get 0 points, okay? They've done it and they get nothing. You as the nurse aren't going to say, oh, well, they must have dementia, right? It's not diagnostic. It's indicative that they need more testing done, okay? That's what it is. So not diagnostic. We can't go just off of these results. But it is really convenient and a nice test. It's easy to administer. It only takes 3 minutes. Anybody can do it. So the nurse, even a nursing student can do it. That's what's so great about it. This does not require a specialist. But if they don't do well on it, we could refer them to a specialist. Another benefit is patients who do not have access to specialists. Maybe you're in the community health setting and they don't have the access to care. You can do this test in the community health setting. And then it can kind of let us know what's going on with the patient and whether they need to follow up or not. So that's the big benefit of it. The limitations of this test, if a patient doesn't know what an analog clock is, a lot of people don't, right? Because everything is digital these days. They're used to digital clocks. So if you ask them to draw an analog clock, they might not know what you're talking about because they're only familiar with digital clocks. So that is one thing that we need to, kind of assess for ahead of time. Lack of writing or drawing, so their inability to write or draw. So maybe they have a physical limitation where they can't do that. That doesn't mean they have a cognitive limitation where they can't do that. And then finally, low educational levels. So they never got education, they never went to school to learn how to do things like draw basic numbers, letters, shapes, things like that. So for these patient populations, this isn't the best test. But for most people, this is a great test. This is a great tool. And I did want to point out that there has been a link between lower scores and low health literacy, so the patient's ability to understand health information. If you remember, in the United States, our literacy rate, so our ability to read and write, is about 5th grade. And our health literacy rate is even lower, okay? So there is an increase of low health literacy when you have a smaller number. Poor knowledge of their own personal medications. So people who don't do as well on this test, on this little assessment tool, don't know their own meds as well. So that's a safety issue. Increase acute care utilization, so they're more likely to be hospitalized. And increased need for assistance, so everyday assistance like help with ADLs. So that's the Mini Cog. It's a really nice, useful tool that you can do as a student that can help assess for cognitive impairment in your patient. I hope you found this helpful. Don't forget to like and subscribe. If you have any questions or comments, please let me know. And if not, I'll see you on the next one.